Okay, so here we are just getting started on the left shoulder. We're looking in from the back to the front. Everything you see is magnified 30 or 40 times on the screen. Here is the biceps tendon coming into the superior labrum. You have this interesting anatomy where you've got a very cord-like middle glenohumeral ligament there. That's not why we're here today, though. We're here because of the rotator cuff tear that you've got. And so as we look at this, first we're going to put in a shaver. And then we'll look over here to the right, and here's the rotator cuff tear. So we're going to reach on the back side of the biceps. And this is where the imaging also showed us that this was essentially a complete tear in the tendon. So we'll just do a little bit of work on this side, and then we'll do most of the work from the supraspinatus, from the subacromial bursal side of this tendon. Okay, so here's the tear. You can see we're all the way up at the front. There's the biceps tendon, which is right where the tear was on the articular side. We've been cleaning off the footprint here, and now we're ready to place an anchor. We'll take a spinal needle next because we want to check our angle to place the anchor down there. We'll turn our brightness up here in just a minute so we can give you a little bit brighter picture. Yeah. And here you can see that looks like a pretty good place to put an anchor right about there. So we'll show you some more in a little bit. Scalpel. Okay, so here's the anchor down. We're going to reach in here. Take one of the sutures out here. And now we're going to get ready to pass some stitches from the back. Hold the camera.